Namaste and welcome to the beautiful city of Varanasi. I'm Dr. Ashutosh and it's my great pleasure to welcome you all to Cardiabcon 25, taking place on March 7th, 8th, and 9th here at Varanasi Villa. Introduction to Varanasi, also known as Kashi or Benaras, is one of the world's oldest continuously inhabited cities. Situated on the banks of the sacred Ganges River, it has been a center of learning, spirituality, and culture for thousands of years. As we gather here for Cardiabcon 25, we're not just attending a conference. We're immersing ourselves in a place of profound historical and spiritual significance. Conference Overview Cardiabcon 25 brings together leading experts in cardiology and diabetology from across India and around the world. Over the next 3 days, we'll explore the latest research, innovations, and best practices at the intersection of cardiovascular health and diabetes management. Welcome to Cardiabcon 25 in Varanasi. I'm Dr. Rahul Bakshi, and today we'll be discussing an important topic in diabetes management: euglycemic diabetic ketoacidosis, (EDICA). Introduction. Euglycemic diabetic ketoacidosis is a life-threatening metabolic emergency characterized by ketoacidosis with relatively normal blood glucose levels. It's a condition that can easily be missed, leading to delayed diagnosis attitude and potentially worse outcomes. Definition and prevalence. EDCA is defined as ketoacidosis, pH 7.3 or serum bicarbonate 18 mmol L with near normal plasma glucose is approximately 100-126 ml. While uncommon, its incidence ranges from 2.6% to 3.2% of TKA admissions. Pathophysiology. The key difference in EDCA's pathophysiology compared to typical DKA is the relative carbohydrate deficit. Carbohydrate deficit plays a pivotal role. Insulin deficit or resistance is relatively minor. Increased glucagon-insulin ratio triggers ketogenesis. Hepatic gluconeogenesis and peripheral glucose utilization remain largely unchanged. Common causes: 1. SGLT2 inhibitors. 2. Pregnancy, prolonged fasting. Let's explore each of these in detail. SGLT2 inhibitors. SGLT2 inhibitors have gained popularity in type 2 diabetes management due to their cardiovascular and renal benefits. However, they've also been associated with an increased risk of EDCA. Mechanism: block glucose reabsorption in proximal renal tubules, cause glucosuria and lower blood glucose, promote osmotic diuresis and volume depletion, trigger glucagon release and inhibit ketone excretion. Incidence: 0.16 to 0.76 events per 1,000 patient years in type 2 diabetes, up to 9% in type 1 diabetes. Risk factors: BMI 27 kg, insulin resistance, significant insulin dose reduction, volume depletion. Pregnancy increases the risk of EDCA due to physiological hypoinsulinemia, increased glucose requirements for fetus and placenta, insulin resistance from pregnancy hormones, hemodilution of blood glucose, increased glomerular filtration rate with glucosuria. Fasting can precipitate EDCA through carbohydrate deficit, depletion of glycogen stores, promotion of lipolysis and ketogenesis. Other causes: bariatric surgery, acute pancreatitis, sepsis, cocaine, intoxication, insulin pump failure. Gastroparesis. Diagnosing EDCA can be challenging due to the absence of significant hyperglycemia. Key diagnostic steps include: 1. High index of suspicion in patients with risk factors. Arterial blood gas analysis for metabolic acidosis. Serum ketone measurement. exclusion of other causes of high anion gap metabolic acidosis, differential diagnosis, alcoholic ketoacidosis, starvation, ketosis, sepsis with lactic acidosis, toxic alcohol ingestion, chronic liver disease. Treatment. Treatment principles are similar to typical TKA. 1. Fluid resuscitation with balanced crystalloids. 2. Insulin replacement 0.1 units class kg hour. 3. Early glucose administration to prevent hypoglycemia. 4. Electrolyte corrections, monitoring until resolution, pH 7.3, bicarbonate 15.0 mmol L, blood ketones 6 mmol L, prevention. Prevention strategies, especially for patients on SGLT2 inhibitors, include 1. Patient education on risk factors, 2. Guidance on sick day management, stopping SGLT2 inhibitors during illness, prolonged exercise, or fasting, discontinuing SGLT2 inhibitors 3 to 4 days before planned surgery. Conclusion: euglycemic diabetic ketoacidosis is a potentially missed diagnosis that requires a high index of suspicion, especially in patients with risk factors. Early recognition and appropriate management are crucial for optimal outcomes. Thank you for your attention. Conference format. The conference will feature a mix of plenary sessions, panel discussions, oral presentations, and poster sessions. We've also incorporated interactive workshops and hands-on training sessions to provide practical skills you can apply in your clinical practice. Networking opportunities beyond the formal sessions. Cardiabcon 25 offers numerous networking opportunities. We encourage you to connect with colleagues, share experiences, and forge new collaborations that can advance the field of cardiopatology. Cultural program. As we're in the cultural capital of India, we've organized some special events to give you a taste of Varanasi's rich heritage. A classical music concert on the evening of March 7th, a guided tour of the ancient Ghats along the Ganges on March 8th, a special Ganga Aarti ceremony on our final evening, March 9th, conference venue of Varanasi Villa. Our conference venue offers state-of-the-art facilities while reflecting the city's traditional architecture. The sprawling lawns and serene atmosphere provide an ideal setting for learning and networking. Logistics. A few logistical notes. Registration and badge collection will be open from 7 a.m. each day. The conference app has detailed program information and a messaging feature to connect with other attendees. Wi-Fi is available throughout the venue. The password is Cardiabcon25. For any assistance, our helpful staff at the information desk will be glad to help. Sponsors and exhibitors. We're grateful to our sponsors and exhibitors for their support. Please take time to visit the exhibition area to learn about the latest products and services in our field. Call to action. I encourage each of you to actively participate in the sessions, ask questions, and share your insights. The collective wisdom in this room is immense, and we have much to learn from each other. Closing remarks. As we embark on these 3 days of learning and collaboration, let's keep in mind the ultimate purpose of our work: to improve the lives of millions living with diabetes and heart disease. The city of Varanasi has long been known as a place of enlightenment. May Cardiabcon 25 bring new light to our understanding and new hope for our patients. Once again, welcome to Varanasi and Cardiabcon 25. I look forward to engaging discussions and fruitful exchanges over the next 3 days. Thank you, and let us meet in conference again.